I need you to listen very carefully to what I'm about to say. Right now, while you're watching this video, there may be a pill sitting in your medicine cabinet. A pill you were told is safe, a pill you may have taken this morning without a second thought. And this pill could be slowly damaging your heart. Not in a way you can feel, not with pain, not with warning signs. Quietly, gradually, over years. And the most frightening part is this. By the time you feel something is wrong, the damage is often already permanent. I've seen this pattern too many times to ignore it. People who did everything right, people who trusted their doctors, people who followed instructions carefully, and still ended up with hearts that could no longer keep up with daily life. Before I tell you the names of these medications, you need to understand what this damage actually looks like inside the body. Because once you see the pattern, you'll never look at medications the same way again. Let me tell you about a man named William. William was 72 years old. He had lived an active life, never smoked, rarely drank, maintained a healthy weight, walked every day. The only real problem he had was knee pain, arthritis, the kind that makes standing up difficult, the kind that turns simple movements into daily challenges. His doctor wanted to help him stay active, so he prescribed a very common pain medication, one millions of older adults take every day. William took it exactly as instructed, twice a day, every day. And at first, it seemed like a success. The pain eased. Walking became easier. He felt more independent again. But something else was happening at the same time. Something William could not feel. That medication was quietly increasing the workload on his heart. It caused subtle fluid retention. It increased resistance in his blood vessels. And with every heartbeat, William's heart had to work just a little harder than before. At first, the heart adapted. It always does. But adaptation has limits. Over months, then years, the strain continued. The heart muscle began to stretch. The pumping efficiency slowly declined. William noticed he tired more easily. He brushed it off as aging. He began sleeping with extra pillows at night. Lying flat made breathing uncomfortable. He didn't connect it to his heart. And then one day, everything changed. William collapsed in his garage. At the hospital, imaging revealed severe heart failure. His heart was enlarged, weakened, struggling to pump enough blood. When his medication list was reviewed, one drug stood out immediately, a drug known to worsen heart function in older adults. William had been taking it for years. No one had warned him. No one had monitored his heart. The prescription had simply been renewed again and again. William survived, but his life was permanently changed. He now lives with advanced heart failure. Simple activities exhaust him. Sleep is difficult. Hospital visits are frequent. And all of it could have been avoided. What happened to William is not rare. It happens because the aging heart has less reserve. When you are younger, your heart has extra capacity. It can handle stress. But later in life, that reserve disappears. Even a small increase in workload can push the heart beyond its limit. That's why medications tolerated at 50 can become dangerous at 70. Now let me tell you about Dorothy. Dorothy was 68 years old. She had mildly elevated blood pressure. Nothing extreme. Something that could have been managed conservatively. Her doctor prescribed a commonly used blood pressure medication, one that effectively lowered her numbers. On paper, everything looked perfect. But inside her heart, something else was unfolding. This medication affected how her heart muscle handled calcium. Calcium is essential for strong contractions. Over time, the heart's contractions weakened. At first, Dorothy felt fine. Then fatigue set in. Walking became difficult. Exercise felt overwhelming. Her heart muscle was slowly being replaced with scar tissue, cells that never regenerate. When Dorothy collapsed in public, imaging showed severe damage. Large areas of her heart no longer moved. The medication was stopped immediately, but the damage remained. Her heart function never recovered. She now lives with permanent limitations. And again, she had never been warned. These stories are not meant to frighten you. They are meant to inform you because there is one more story you need to hear, and this one involves a medication millions take every day for stomach discomfort. A medication many people believe is completely harmless. In the next part, I'll explain how this medication quietly disrupts heart rhythm, why the damage often becomes permanent, and why seniors are especially vulnerable. Stay with me. Now, let me tell you about James. James was 76 years old. He had one main complaint: chronic acid reflux, burning in the chest, discomfort at night, poor sleep. His doctor prescribed a medication to reduce stomach acid, a very common one. Millions of seniors take every single day, and it worked immediately. The heartburn disappeared. James slept better. Life felt easier again. So he kept taking it, month after month, year after year. What James didn't know was that this medication was quietly interfering with his body's ability to absorb magnesium. Magnesium is not just a mineral, it is essential for heart rhythm. Every heartbeat depends on a precise balance of electrical signals. When magnesium levels drop too low, those signals become unstable. At first, James felt nothing, but over time, his magnesium stores slowly declined. No one checked. No one monitored. Then one evening, his heart began racing. Irregular, chaotic. He felt dizzy, weak, unsteady. Paramedics arrived and recognized the rhythm immediately. Atrial fibrillation, a condition that dramatically increases stroke risk, a condition that often becomes permanent. Blood tests revealed the cause: severely low magnesium. The medication he had taken for years had blocked its absorption. The drug was stopped. Magnesium was replaced, but the heart rhythm never fully recovered. James now lives with permanent atrial fibrillation, blood thinners, ongoing risk, a condition that could have been prevented. And this medication was never meant for long-term use. Short-term relief became long-term damage. Now you've heard 3 stories, 3 different medications, 3 different mechanisms, one common outcome: silent heart damage. And here's the uncomfortable truth: these medications are not dangerous for everyone. Some people take them for years with no obvious harm, but others are genetically or physiologically vulnerable. And there is no way to know who is vulnerable without monitoring. That's where the system fails. Medications are prescribed, prescriptions are renewed. But hearts are rarely checked, especially in older adults, because most of these drugs were never properly studied in people over 70. They were approved based on younger patients, short-term data, simplified assumptions, then prescribed long-term to seniors with far less physiological reserve. This is how damage slips through unnoticed. Now it's time to name the medications. Not to scare you, but to give you knowledge. The first group is non-steroidal anti-inflammatory drugs. Common pain relievers used for arthritis and joint pain. They increase fluid retention, raise blood pressure, strain the heart. In older adults, they significantly raise the risk of heart failure. Safer alternatives exist. The second group includes certain calcium channel blockers. They can weaken heart muscle contractions over time, in susceptible individuals. Without monitoring, damage can accumulate silently. The third group includes acid-suppressing medications used long-term. They interfere with magnesium absorption, destabilize heart rhythm, increase the risk of atrial fibrillation. The fourth group includes certain diabetes medications that cause fluid retention and worsen heart function. The fifth group includes older antidepressants that affect heart rhythm and electrical stability. The sixth includes certain rhythm control drugs that paradoxically worsen heart failure in older adults. And the final group deserves repeating. Pain medications taken daily, assumed to be harmless but capable of destroying heart function over time. I am not telling you to stop any medication on your own. That'll be dangerous. But I am telling you this. Every medication deserves regular review, especially after 65. You have the right to ask questions. You have the right to request monitoring. You have the right to ask whether safer alternatives exist. A healthy heart is not something you can replace. Once damage occurs, recovery is limited. In the final part, I'll show you exactly what to do next. How to review your medications safely, what warning signs to watch for, which tests can detect damage early, and how to protect your heart without fear, but with clarity. Now let's talk about what you can actually do, because the goal of this video is not fear, it's protection. If you're over 60, medication safety becomes just as important as the medication itself. Here's the first step. You need a complete medication review, not a quick glance, not a rushed appointment, a real review. Write down every pill you take, prescription medications, over-the-counter pain relievers, acid reducers, sleep aids, even supplements. Bring that list to your doctor and ask one clear question. Which of these medications could affect my heart over time? If your doctor dismisses the question, that's a warning sign. If your doctor says, you've been on these for years, so they're fine, that's another warning sign. Long-term use is exactly what creates risk in seniors. The second step is monitoring. If you take medications that affect blood pressure, rhythm, fluid balance, or electrolytes, your heart function should be checked periodically. This may include imaging of heart pumping strength, blood tests that reflect strain or imbalance, electrolyte monitoring when absorption may be impaired. Many of the patients I told you about could have avoided permanent damage if monitoring had been done early. The third step is alternatives. For pain, there are non-drug approaches, targeted physical therapy, topical treatments, lifestyle adjustments that reduce inflammation. For reflux, diet timing, meal size, body position, and short-term solutions often work better than lifelong medication. For blood pressure, the safest strategy often combines lifestyle changes with medications that support, not weaken, heart function. You are not refusing treatment when you ask for alternatives. You are choosing safer treatment. The fourth step is awareness. Heart damage often starts silently. Fatigue that seems normal. Shortness of breath with mild activity. Needing more pillows at night. Reduced exercise tolerance. These are not always aging. Sometimes they are warning signals. And finally, advocacy. No one will protect your heart more than you. Doctors are human. They follow guidelines. They work under time pressure. They may not connect your symptoms to a medication unless you ask. That doesn't make them bad. It makes your involvement essential. Now, let me be very clear about something. Medications save lives. They are not the enemy. The problem is unexamined long-term use in aging bodies. What was safe at 50 may be dangerous at 70. What worked for one person may harm another. That's why individualized care matters. If you take nothing else from this video, take this. Never assume a medication is harmless just because it's common. Never assume long-term use means safety. And never assume symptoms are just aging without questioning. Your heart works tirelessly every second of your life. It deserves careful protection. Before you go, do 3 things. First, review your medications this week. Second, talk to your doctor about cardiac monitoring if you're on long-term prescriptions. And third, share this information with someone you care about. Many seniors trust their medications completely. This knowledge can prevent irreversible damage. Subscribe to this channel if you want clear, calm, evidence-based guidance designed for older adults. No fear, no hype, just information that helps you make better decisions. And leave a comment. Tell me how many medications you're currently taking. Your experience helps others realize they're not alone. Thank you for spending this time with me. Your heart matters.